need somebody to throw punches.
The Virginia Cable Telecommunications Association and your local cable provider presents Cable Reports. Join us now as Cable Reports brings you up to date on current issues facing the Commonwealth through discussions with your local legislators and other policymakers from across Virginia.
Hello, I'm Ray Lemura. Welcome to this edition of Cable Reports. Our guest today is the Lieutenant Governor of Virginia, Ralph Northam. Welcome, Governor.
Thank you for having me this morning, Ray.
Glad you could be here.
It's great to be here.
Great. Governor, you have an extraordinary history, past. I'd like to have you share with our audience a little bit about you. You're from your days in college and on.
Right. Well, I'll be glad to. And I appreciate you having me on your show this morning. But I was born over on the Eastern Shore in a little town called Nassawattix. A lot of Indian names over on the Eastern Shore. That means land between two waters. I tell a lot of people the Eastern Shore is that part of Virginia that's often left off the map of Virginia. So that's one of my main goals here in Richmond, is make sure whenever I see a map that we include the Eastern Shore. And anyway, I went to the public schools on the Eastern Shore. My mother was a nurse on the Eastern Shore. My father was a Commonwealth's attorney, and then he became a judge. And in high school, I was a member of a couple different clubs, student government, and played on all the sports teams, basketball and baseball. I was in the marching band, played the French horn, and I did well in school, but didn't have a whole lot of direction coming out of high school. And my brother was 2 years older than me, and he went to VMI, and I applied to a couple schools and was accepted. But at the end of the day, I said, well, my brother's there, he'll be able to look out for me, and so I ended up going to VMI in Lexington. And initially, I was in the Navy, ROTC, and I grew up, working on cars, and my brother and I actually had a stock car in high school, and so I was going to fly in the Navy. And then my second year at VMI, I took the vision test, and they said that I wouldn't be in the front seat of a jet. And so, long story short, I switched and became a biology major, joined the Army. And upon graduation from VMI, I took a commission in the United States Army. I was accepted to medical school at Eastern Virginia Medical School, and I graduated from there in 1984. And then I did 3 years of my pediatric training down in San Antonio at Brooke Army Medical Center, and then became interested in neurology. I had a mentor down there that was a pediatric neurologist, and we got along real well. And I thought it was interesting, and so I applied for a fellowship, and I went to Walter Reed Army Medical Center in Washington and did my child neurology fellowship. I did a half a year of chief residency up at Johns Hopkins during that time. So I had good training. As soon as I finished my training at Walter Reed, Desert Storm kicked off. And I was put in charge of the neurology and neurosurgery service at Landstuhl Army Medical Center. And for those that have followed the wars in the Middle East, the patients are stabilized in the desert, and then they're transported to Landstuhl. Ramstein Air Force Base is right beside Landstuhl. And so during that conflict, we were probably taking 15 to 30 casualties a day. So it was very busy. It was a good experience. But and then in 1992, Pam and I had two small children, young children by that time, and so I said after 8 years of the Army, I thought it was time to settle down. So we moved back to Norfolk, Virginia, and I became a partner in a group called Children's Specialty Group at the Children's Hospital of King's Daughters as a pediatric neurologist. And I've been on the staff there since 1992. I have 4 partners. They are very kind to me and gracious and allow me to do what I do in politics.
Right.
So it's been a good relationship. One of the things that I am proudest of, and I have done on a volunteer basis for about 15 years now, is I'm the medical director of Edmark Hospice. And that's the only pediatric hospice in the state of Virginia. And when I started 15 years ago, our census was about 18 children with terminal illnesses, and now it's over 60. So I oversee the care of about 60 children and their families that have terminal illnesses. And you know, it's been it's very sad, as you might imagine, but it's also very rewarding for those families to put their trust in a doctor at that time of their life. And so it's really helped put my life in perspective.
Sure.
The things, small things that people get upset about, they just they don't bother you, because if you think about what those families go through, again, it has really put things in perspective. So, you know, so in 2007, I actually was meeting with my chairman of pediatrics, and we were talking about our grants and our research that we were doing, and just kind of overall how are things going. And I was a little bit frustrated. I said, you know, the doctors, we're working more, we have less to show for it at the end of the day. The insurance companies are kind of ruling our lives. And so he was a man of a few words, and he said, well, why don't you do something about it? So I walked out and I said, well, maybe I can do something about it. And that's when I decided to get into politics. And so I ran for the Senate in 2007. I was essentially naive politically. I had no experience, either at the local level or anything. And I ran, and the 6th District covers the Eastern Shore, which is where I'm from, and about half of Northam, a little bit of Virginia Beach, and then Matthews County. And so we were successful. I re-ran in 2011 and was successful. And then in 2013, I talked to my wife and children and my political partners, and we decided to run for lieutenant governor. And so I ran for lieutenant governor in 2013, and we were successful. And here I am. So it's been quite a ride, but it's been a great experience. And you know, one of the things that I would remind folks of is that the lieutenant governor's position, on paper at least, is part-time. Our salary for lieutenant governor is $36,000 a year. So I maintain my medical practice when I'm not in Richmond. And so it's been a balancing act, but it's been a great experience. I've learned so much about the Commonwealth of Virginia. We have a wonderful state that we live in, a tremendous potential, beautiful areas from the east to the west, and I have continued to maintain my practice in taking care of sick children, and hopefully I've been able to bring some of that experience to Richmond and work with folks and do what's in the best interest of the Commonwealth.
Right.
So it's all been good.
Well, you have quite a heroic background, and quite frankly, your work with the children is even more heroic. So thank you for your service there. So, as a senator, you've also had a very accomplished legislative agenda.
Right.
Why don't you share some of the accomplishments you had?
Well, it's kind of interesting. I appreciate the question. You know, when I came to Richmond in 2008, and I was sworn in January at the beginning of session, and I really came here realizing that I didn't know a lot about politics, and I just wanted to learn the system and make good relationships. And shortly after I was sworn in, I had a visit from the governor, at that time Governor Kane, and one of his agendas was to ban smoking in restaurants. And he and I sat down, and he said that, what better person to carry that legislation than a pediatrician? And so when the governor asks you to do something, you say yes sir or yes ma'am. So I literally jumped in the deep end in 2008, and I did patron that legislation. It passed in the Senate in 2008. We were unsuccessful in the House. I reached out to folks on both sides of the aisle in the off season. We came back in 2009, passed it through the Senate, and it was passed in the House, and the governor signed it into law. And you know, of all the things that I've done, that's one of the things that I'm proudest of, because we know that secondhand smoke is dangerous, not only to adults but to our children, to people that work in restaurants. So hopefully that has made Virginia a safer place. And you know, the discussion about that particular piece of legislation was that, well, that's too much government in our lives, and the government shouldn't be telling restaurants, you know, how to do business. But at the same time, I think that we as legislators have a responsibility to protect Virginians. And so I think it has made Virginia healthier. And so in this case, I think it was appropriate to step in and say, look, it's really not good. If someone wants to smoke, they can go outside, smoke in their house, wherever they want, but not in restaurants where other people are exposed to the smoke. So that was kind of my beginning of my career politically. The other thing that I've spent a lot of time on as a senator was working with concussions. Mm-hmm. And we, in pediatric neurology, see a lot of our children who sustain concussions. And I would say up front that I want to encourage our children to participate in sports. And the last thing I would ever do is say, you know, that you shouldn't be playing football or playing soccer or cheerleading or whatever. It's a good thing for our children to get out of the classroom, get out of the house, and get exercise and be healthy. But we want them to be safe as well. And so in my practice, there were like 26 different lists of criteria for how to diagnose and manage concussions. And so what that legislation did was we came up with one set of guidelines, working with the Virginia High School League, working with the American Academy of Pediatrics, and made it very straightforward as to how to recognize and then how to manage concussions. And the main message with that was that if someone sustains a concussion, that they're removed from play, and they're evaluated by a provider and cleared before they can return to play. Because we know there's what we call a second impact phenomenon, which is very dangerous, and that is if someone sustains a concussion and it doesn't completely heal, and then they have a second concussion, they're at significant risk to have this second impact phenomena where they have increased intracranial pressure. And we've had athletes, unfortunately, who have died from that. So, right. So anyway, so I think, again, the work that we did, and again, that was in a bipartisan way. I had a lot of folks that really helped out with that, but that has made it safer for our student athletes. And it's also helped, I think, our coaches and parents better understand about concussions and how serious they are and how to manage them. So those are a couple of things that I've worked on. I grew up on the Chesapeake Bay. Right. The bay was literally my backyard, and if you can, fish, crab, whatever, ski, whatever you can do on the water, I've done. And so one of the things that I have watched over my lifetime has been the demise of the bay, and so I have been focused on trying to clean up the bay for our children and their children, so it will be like it was when I grew up. And when I was growing up, there were plenty of fish, crabs, oysters were doing well, and then we really saw a decline in all of those stocks. And so we're working very hard not only to clean up the bay, but to prevent the things that are contaminating the bay, and we're making good progress. And so that's something that I have been proud of and will continue to work on.
That's fantastic. And also, you do some work with communicable diseases for first responders as well.
Right. That was a piece of my legislation, I think my second year that I was here. And basically what that says, I mean, these are the folks that put their lives at risk, that put their lives on the line. And as I say, when we're trying to get away from the scene, they're going into the scene, and they can be exposed to some very dangerous things, to include bacteria, viruses. And so basically what that says, if a first responder gets into a situation where he contracts an illness, then he will be taken care of. He or she will be taken care of. And so that was a way that we just wanted to kind of thank and protect our first responders.
All right. So you were talking a little bit as your role as a lieutenant governor really is to be the president of the Senate, but you're also involved in some other initiatives that I think are quite important.
Right.
And early childhood education is one of those. So I want to talk a little bit about that.
Yeah, no, that's great. My primary job as lieutenant governor is to preside over the Senate. We have 40 great senators. I consider them my friends. I really enjoy going to work every day, and it's a a place of a lot of tradition, a lot of rules, but we also have a good time, and they're very smart and they have great personalities. So it's been a great experience. And what I like to tell people is that in the event of a tie, then the lieutenant governor breaks the tie. So,
Right.
so I remind my fellow senators that when I was a senator, I went to a lot of committees and voted a lot on different bills, and I won some and I lost some. But as lieutenant governor, every time I vote, I win. So
That's right.
it's been a good deal. So it's good being lieutenant governor. But we're in session for 2 months, and then there are 10 months in which we can work on other projects. And the Governor McAuliffe, has been very kind and gracious to me and said, Ralph, you have experience in pediatric neurology, you have experience in mental illness, put some of that to work. And so he's allowed me to be involved in several projects. And you asked about the early childhood development. The governor formed the Children's Cabinet, and the Children's Cabinet is composed of different cabinet members, the Secretary of Education, for example, Ann Holton, Secretary of Health, Bill Hazel, Secretary of Commerce, Maurice Jones, and I'm on that cabinet. And then within the Children's Cabinet, we have the Commonwealth Council on Childhood Success, and so I chair that. And what that council is focusing on is early childhood development, and we're looking at several areas. And the first, which I think is probably the most important, is pre-K education. And I can just tell you, as a parent and as a pediatric neurologist, there's a tremendous learning potential in our children before they ever get to kindergarten. And I use the analogy that if Pam and I, my wife, have the means to send our children to pre-K, which we did, and our neighbors don't have the means, then that's really what starts the gap between the haves and the have-nots. Mm-hmm. And all I'm asking is for everybody to have the same opportunity in Virginia. So we want to increase access to pre-K education for those that choose. And just a quick statistic, we know that if children aren't reading by the time they're in the 3rd grade, there's a very good chance that they're going to end up in our penitentiary system. So it's one of those things that you can either pay for it now or pay for it later.
Right. Either way, you're paying for it.
You are. And it's not just about the didactics of learning, learning our numbers and letters, but it's about good, health decisions, good nutrition, staying away from cigarettes, drugs. Our children are so impressionable at the age of 3, 4, and 5, so if we can get to them, that may be our only chance for some of these children. And as I say, once they're teenagers, anybody that's raised teenagers or been around teenagers, it's a lot easier to work with a 4-year-old than it is a 14-year-old.
Right.
So anyway, so pre-K education is something that the governor, it's high on his agenda list. We've received a grant this year for $17.5 million that will hopefully go over 4 years, so over $70 million that we're putting into pre-K education. So I'm very excited about that. A couple other areas in early childhood development, one of which is safe childcare and accessible and something that people can afford. When I was growing up, my dad worked, my mother worked part-time, but she was at home. But most families now, both parents work, and so it's very important for them to have access to quality and affordable childcare. So we're working on that across the Commonwealth. And then finally, we want our children to be healthy when they go to school in the morning, and so that means that their immunizations need to be up to date. They need access to a primary care provider. They need good nutrition, and I would just take a second to compliment our First Lady, Dorothy McAuliffe. One of her agendas is to make sure that our children have good nutrition and that all children, when they go to school and start to learn in the morning, that they're not hungry. And
right.
So that's really commendable. So anyway, kind of a long-winded summary of what we're doing with early childhood development. But we have on that council about 30 diverse individuals from across the Commonwealth that are very involved. There's a lot of enthusiasm from the business community from an economic development standpoint, preparing our children for the workforce. So pre-K is very important to the business community, the chambers across the Commonwealth. So I'm enthusiastic. I think we're going to get some good things done over the next couple of years with early childhood development.
Great. You had a recent editorial in the Roanoke Times.
Right.
I'd like to have you just chat a little bit about that.
Yeah, well, that addressed Medicaid expansion, and I'll just take a couple seconds to go through that with you if I can. My job in working with the governor is with economic development, and that is retaining good businesses and jobs, but also recruiting businesses, manufacturers to the Commonwealth of Virginia, because we know that if we provide jobs for Virginians, that's what moves Virginia forward in regards to transportation, education, health care, first responders. So that's our main focus, speaking on behalf of the governor and what I do to help him. Now, if you look at what would attract a company to come to Virginia, there are several things. One is a competitive tax code. I think that we do well in Virginia. We're very competitive with other states. As I say, we're lean and mean. In Virginia, we have a balanced budget each year, which is a good thing. So that's the first step. Infrastructure is important. We need to tell companies that want to come to Virginia that we have good roads and highways and transit. That's very important. Another thing is education. We talked about that we want a world-class education system in here in Virginia to train the workforce. And then the one that I will talk about just briefly with the Medicaid expansion, which is what the editorial was about, is health care. And if a company, let's say, is going to bring 500 or 1,000 employees or have those employees from Virginia, they want to make sure that their workforce has good medical care and that their families are taken care of. So the Medicaid expansion is part of the Affordable Care Act. And, some people say, well, I don't like the Affordable Care Act. But there's some good things about the Affordable Care Act, and there's some things that we need to fix. But I would say to that, let's sit down at the table and stop playing politics and say, how can we make it better, and let's do that. And so we're making some headway there. But the Medicaid expansion is part of the Affordable Care Act that's designed to provide health insurance for up to 400,000 working Virginians. And I would underline the word working. This is not what some people say another handout. These are Virginians that are working 1, 2, and 3 jobs. And what has happened is that the cost of health care have risen a lot faster than people's salaries. So they're working, but they can't afford health insurance. And so you ask yourself, well, where does someone go for their care when they don't have health insurance? And the answer to that is they go to the emergency room.
Right.
If they make that decision, they may have to decide that they need to put food on the table or buy clothes for their children and not even go to the emergency room. But I can tell you that there's a time and a place for the emergency room, but it is not the place for primary care, for education, those types of things. And as far as being expensive, you talk about ringing the cash register. It's just very expensive. So the Medicaid expansion is designed to provide coverage so that these working Virginians would have access to a provider. And so from a moral perspective, it's the right thing to do. And I would just remind people that, a lot of us have the luxury that when we get sick, we can, call our doctor or go to the hospital or whatever and be taken care of. But that's a frightening feeling when someone gets sick and they don't have coverage and nobody to take care of them. So morally, it's important. The other side of it that I tried to emphasize in the editorial or the op-ed is the business side of it. And I go back to, we run the Commonwealth of Virginia like a business. And so we are losing over $4 million a day, per day, that we're giving to surrounding states who have opted into Medicaid expansion that, by the way, we're competing with. And so from a business model, I mean, you ask any businessman or woman if that's a good business deal to say, I've got $4 million on the table, but I don't need it, I'm going to give it to my competitor. It doesn't make sense. So from January 2014 to now, we have giving away well over $1 billion to surrounding states. And so I would come back, and just to come full circle, I started this conversation about economic development. Let's take the Southwest, for example, where the coal industry is not as healthy as it used to be, and we're trying to bring new jobs, new manufacturers to the Southwest, and we have just lost a hospital in Lee County, which is the westernmost county in Virginia, because they just couldn't afford to keep the lights on. So when this company calls and says, we're interested, Governor McAuliffe, in coming to Virginia, by the way, how is health care out in the Southwest? Well, we've just had to close down one of our hospitals. Then, so that's not a good message. And the other thing that I would say, as a provider, as a physician, why would I want to go practice medicine in an area where the hospital just closed? So it is very important from a business perspective to take advantage of tax money that Virginians have already paid into the system to support the Affordable Care Act. All we're asking is to bring that revenue back to Virginia. And I don't think that's a big ask. And so again, as we run the Commonwealth of Virginia, we don't want to give away money to other states. And so I will continue to work on that message. And just finally, for the first 3 years, it's 100% funded by the federal government. No money would come from Virginia. And then after that, 90% funded by the federal government, 10% from Virginia. So it's still a good deal for Virginia. And a number of states across the country, both Republican and Democrat, have opted in for Medicaid expansion. So I will continue to work with the legislators and the governor's staff and try to move that agenda forward.
Right. We just have about a minute left.
Yes.
And I know the budget is something that you help play a role in.
Right.
Why don't you talk briefly about that?
Well, we do. We balance our budget each year in Virginia, which is a good idea, I think. I wish they could do that in Washington. One of the things that I am proudest of this year, and I commend the governor and the legislators, we have made no cuts in K through 12 education, which is important. The other area that I'm excited about is we're taking care of our veterans. We've given lip service, I think, in the past, but we still have homeless veterans. We're going to end homelessness in Virginia because of some budget amendments. We're going to make sure that our veterans, when they come back from Afghanistan and Iraq, are able to enter the workforce, that they're able to be educated, and finally that their medical needs, and if there are mental health issues, post-traumatic stress disorder, those types of things, we're going to take care of our veterans. So overall, I think it's been a good year. I'm proud of our legislators. We have come together in a bipartisan fashion to get a balanced budget, and I look forward to the years to come.
Right. And that was one thing I would say is your reputation is as a working bipartisan manner, and I want to commend you for that.
Well, thank you. And I haven't been here that long, but I have learned that in order to get anything done, one has to compromise, and so that's what it's all about here in Richmond.
Great, great. Well, you've done a very impressive job, and I really appreciate the time you've taken with us today. Your accomplishments are extraordinary, and the service that you've done in the military and then with your medical contributions as well are so very, very impressive. And we in Virginia are very appreciative of the service you've given to all of us. So,
well, I appreciate you having me on here, and again, it's been a privilege to serve the Commonwealth, both as a senator and lieutenant governor, and I look forward to continuing to move the Commonwealth in a positive direction.
Great, great. And thank you for watching this edition of Cable Reports with our special guest, Lieutenant Governor Ralph Northam.